So one of the ways that, another way rather, that people consume cannabis is orally. They will ingest it, or as we would like to call it, edibles. So infusing cannabis into foods is actually a very popular method of consumption, due to its softer, it has a much softer onset of effects, and then the duration of the effects is much longer compared to inhalation. Cannabis oil can be infused into almost any food or drink, and it can also be swallowed in like a gel-like capsule. People like to make their own cannabis oil capsules and just take it like a pill. Effective doses are assisted, or the digestion of that is assisted when you use a good carrier oil like an MCT, the medium chain triglycerides, or a coconut oil. Most edible capsules and infused beverages are in Illinois, and not most edible capsules, most edibles, capsules, and infused beverages are limited to 100 milligrams of THC per package here in Illinois. You might find some variation in other states, but it is, according to the law, everything, it has to be just a maximum of 100 milligrams. Most of the time, you'll see these divided up. They'll be scored, and divided into individualized servings of 10 milligrams each. Chocolate tends to be a fan favorite, or a favorite of cannabis infusers and processors, and of consumers, of course, because chocolate has a nice fat content, and it has caffeine, all of which helps to assist with the digestion of the cannabinoids, and sometimes can help to mask the flavor if there's if it has a heavy kind of weedy flavor to it. You can get like a dark chocolate or something like that that will help to mask the flavor. So when we're looking at dosing, people always want to know, well, how do you know what is the right dose? And this is provided by, you can see here, it's provided by Leafly, and these are just kind of some approximations. But the amount of THC in an edible really has a significant impact on the effect. Um, just like any other pharmaceutical drug, or any other or holistic medicine. So people tend to, especially if you're a patient and you're using it for therapeutic purposes, um, it takes people a little while to figure out what is the maximum effective dose. So many people find that they can get, a good amount of relief from just taking um, micro doses, right? Just small amounts of the THC. Some patients find this to be a better way to consume their cannabis, to consume their medicine, and it gives them a little bit more of a steady, consistent relief versus and especially if you have to be active and doing stuff throughout the day, and you want to have consistent relief throughout the day, you might just want to stick with a microdose. So typically, a microdose is just between 1 and 5 milligrams of THC, and you can see from this chart here that there's different feelings, different things to expect as you increase the amount of THC that you consume. So at the 1 to 2.5 milligrams, there's a mild level of relief of pain, stress, anxiety, and other symptoms, and it can have an improved focus and creativity. So this is good for first time consumers, um, people who just prefer to microdose their cannabis. Then you have, at the 2.5 to 15 milligram level. So this is a moderate amount, or it's still a low amount, but it's a little bit more than a microdose. You obviously get stronger symptom relief. You might have some feelings of euphoria, but it also can impair your coordination and alter your perceptions. So patients who have really persistent problems, people who are restless sleepers, and then this says social butterflies. I'm not really sure what that's supposed to mean, but I guess at that level, you can still be social. You're not just zooted it out, just zooted it and stuck and, looking stupid. So at the 15 to 30 milligrams level, you have, stronger feelings of euphoria. People who are not accustomed to consuming may have some more negative effects. So you might have some paranoia. And the more THC in the edible, um, the higher the more THC consumed, period, really, the higher your chances for experiencing paranoia. And then it may impair your coordination again and alter your perception. Typically, people who are well seasoned consumers or medical patients that have a little bit more of a tolerance, and or experienced consumers that are trying to sustain sleep. This is where people will kind of find that sweet spot within the 15 to 30 milligrams amount. And then from 30 up to 50, so, obviously it's getting stronger and stronger and stronger. It's a very strong euphoria for customers who are um, unaccustomed to, not customers, I should say consumers, who are unaccustomed to consuming cannabis. And very likely to impair your coordination and definitely alter your perceptions. Those who have people who would be good for this, right? Who would this be for? Is consumers that have poor gastrointestinal absorption of cannabinoids. So when we're talking about edibles, when we're talking about actually ingesting cannabis, it goes through your whole intestinal system, and it goes through your liver, and there's different changes that happen. Um, which you can learn more about that in other classes and later in the program. But um, and then people that have a significant tolerance to THC, they can handle edibles at this higher level. But you want to start low and go slow. That's what we always tell people. That's what you know. That is kind of the general rule with edibles. You just never know how it's going to affect you. And given the onset time and how long it takes, and I don't feel like we really discussed that a whole lot, but given the onset time and how long the effects last, you want to give it time, to really kick in, right? And what tends to happen is that people will over consume or consume too much THC because they either forgot that they took the edible or felt like it wasn't doing anything, or thought that they didn't take enough. And then once you're on that train, it's gone. There's nothing you can really do about it. So you want to be just more careful your as it relates to the edibles, right? And if you're advising people, you definitely want to make sure that they are, starting low and going slow, especially as their first time or new novice consumers. At the 50 to 100 milligrams level, listen, even really experienced consumers are going to have a hard time, right? It's highly likely to impair your coordination and alter your perception. You're probably going to be stuck, probably just going to pass out, go to sleep. But you can and will experience some negative effects like the rapid heart rate, nausea, and pain, maybe even vomiting. There is something called hyperemesis syndrome, which is the result of overconsumption of THC. And you're just throwing up all over the place, right? That's when you've had too much. And how it affects you and how it affects your body is going to be based on, you know, who you are, what your experience level is, what level of health you're in. People that are like cancer patients or who have, really inflammatory diseases, they tend to take it at these higher levels, right? They tend to have to have these higher dosages just to handle the levels of pain that they're in, and to have the most therapeutic effect on their situation. Those levels, those doses are not necessarily um, advisable for just your casual recreational cannabis consumer. All right, moving on. Let's talk about sublingual absorption. So sublingual is means under your tongue, right? And these are what you're looking at here is a picture of a tincture. So tinctures you take as a drop under your tongue, um, and it's absorbed into the bloodstream that way. So the cannabinoids and any other compounds or terpenes are suspended in either an oil, or an alcohol-based tincture, and it can be dosed by a dropper or even by a spray, right? Alternatively, it can be infused into like a hard candy or a dissolvable gelatin strip, so something that will dissolve on the tongue. Also put it into like a lozenge, things of that nature. And this is a really good method of consumption for people who have lung sensitivities or just a general aversion to inhaling cannabis. It is a very a commonly used um, type of medical cannabis. All right. So a topical or skin application of cannabis is like it could be a salve or a lotion or a bath bomb, and they will typically provide immediate relief. They're usually formulated with other compounds that will help them to absorb into the skin, and getting into where it needs to get into, getting into the muscle, into the skin. Typically, they do not pass into the bloodstream. So you should not have any psychoactive effects from the use, from using a topical. And most anecdotal evidence really indicates that it's better to have like a 1-to-1 ratio of CBD to THC in a topical to make it the most effective. So you're looking to take advantage of, anti-inflammatory benefits as well as the analgesic benefits of the CBD and the THC. When we talk about another type of topical application is a transdermal patch. And so transdermal patches, they will have the cannabinoids in them, similar to like even like a nicotine patch or a birth control patch. I don't even know if they still have those, but excuse me. The cannabinoids in those are treated so that they will pass through the skin and into the bloodstream. They really don't necessarily cause a real psychoactive effect because they release a real low and steady dose, over the course of time. Um, the duration of time for like a transdermal patch can be, 8 to 10 hours, right? Or, so that's at least what they'll say on the labels. I'm going to assume that those exist somewhere. Typically speaking, I've gotten a good, 4-5 hours of relief from using a transdermal patch for like back pain and things of that nature. You'll find those in the dispensaries as well. I'm not sure if they're just in the medical dispensaries, but you will see them out. Um, the patches are good because they're really discreet, and they help with not having to dose as frequently throughout the day. So, if you're working in an office, or if you have to work outside of the home and you want to, still have your cannabis medicine, for treating your pain or whatever it is that you're using it for, you can use the transdermal patch, and that will that's a discreet way for you to get your medicine as well. When it comes to the patch, just one last thing. When you want to aid it in actually entering the bloodstream, people should absolutely put it on an area like your inner wrist or the top of the foot or the back of the knees where it can have more access to, you got some good veiny parts there. And the patches are available in a variety of different doses and cannabinoid ratios. So it could be a 1-to-1 of THC to CBD. You might see some that have some THCA in them or CBN in them as well. And then one last thing as well, there are actually bath bombs that are and that's a really good way to treat pain as well. It combines cannabinoids with other compounds like Epsom salts or baking soda and other like essential oils that assist in helping with muscle relaxation, pain relief, and then full body detoxification, right? So that's, one of the methods of using the bath bombs is actually soaking in, nice, real good warm water for as long as you can. I mean, they'll recommend it to be, at least up to an hour just to get the full benefits. There's no danger of overdosing or anything like that. So with that particular method, because again, it's not going into the bloodstream, it's really just treating the muscles and the skin at that point. So you might see some really high dosed bath bombs out on the market as well. So that concludes our discussion about consumption methods and um, you know types of cannabis products. I will talk to you soon. Bye.